everybody, it's Tina coming back at you with some new psychological information. Today we are going to talk about schizophrenia. Now I know probably everybody's heard of it. Some people have experienced it in their families or in their social groups. And a lot of times schizophrenia gets a bad rap because people say, oh, that person's schizo, meaning that person's crazy, and that's not the case. So I hope that the information I provide to you today will help debunk these rumors and help you understand more what people with schizophrenia go through. Now, first off, it's a chronic disease. So it's a brain disorder that has affected people throughout history. Some of the most famous people in history were schizophrenic or some type of major depression. Some of the great artists, the great musicians of our time, they had mental illness, and a lot of them had schizophrenia. So, it is a cognitive disease, so it does deal with your thinking and your rationalization and making good decisions and even knowing where you are at any given time. It really affects your cognitive abilities. Some of the signs and symptoms of it are hallucinations. They can have auditory, olfactory, visual, and that's pretty much it. I mean, they have hallucinations. They see things that are not there. They smell things that are not there. They hear things that are not there, or that others don't see. And that's a real big one. Another one is delusions of grandeur, or just delusions. And that's when paranoia can come into play, because they start to think that people are after them, people are taking their brain away, or there's somebody that they're not. And they just, when they have ideas of persecution, is what we call it, that means they feel like somebody's out to get them. The radio is reading my mind, or the thermostats were talking to me, telling me to kill myself. Because the voices that they hear are not usually happy voices. I haven't heard of an instance where they were telling them, hey, good job, you're doing well. Every voice is usually negative, and it's telling them to kill themselves, that they're worthless, that they're no good, they don't deserve to be on this earth, they don't deserve to be happy. And sometimes they get so many voices in their in their minds, that they can't even distinguish one voice from another, and sometimes the voices talk to each other. And the person can hear this. Now, how do they hear it? It's not like they're hearing it in their brain, like when you're thinking about something in your head or you're reading to yourself. It's not like that. What it's like is somebody's actually standing on the side of you and whispering in your ear. That's what's been reported as how they hear their voices. They don't hear them like there's a radio going off in their head or anything. It's like someone is actually there at their ears talking to them and giving them all these command voices. That's what we call them, command voices, because they're telling them to do things. Sometimes these people do listen to what these things tell them to do, to hurt themselves, to hurt others, But I'm going to tell you, my experience is people with schizophrenia, especially when it's very severe, are not usually people who would hurt somebody. They are people who are usually victimized. I've seen them victimized financially, just different ways. Their items getting stolen, people acting like they have the person in their best interest when they really don't. So they're more victims than they are perpetrators. I'm not saying that they can't get violent, because they can, but then everybody can. Everybody, the ones we talked about before, depression, they can get frustrated and irritated with someone that could cause them to lash out. Same thing with bipolar. You never know what you're going to get with a bipolar. And now schizophrenia. Now, Another thing about them is they may sit quietly for hours and not say a thing. They could be rocking in their chair or just sitting there, but their mind's working and they're listening to their mind, so they're not paying attention to what's going on around them. They're too busy listening to what's going on in their head and talking to themselves. Sometimes they'll mumble to themselves. I had a client one time that she was taken to HEB in Corpus, and she was just quiet usually. She usually just sat there and rocked, and she usually didn't say nothing. And when her purchases were being made, she went and sat down on a bench, and she was rocking, talking to herself. And then finally she yells out loud enough for everybody to hear, "Maybe I do need sex after all." And we laughed about that, because something in her head was telling her she needed sex. And she finally blurted just that statement out and then didn't say anything before or after. So that's how that works, with that. Many people with schizophrenia have difficulty holding jobs or functioning, and so they tend to need care. And I know that one of the jobs that I had for the schizophrenia people with schizophrenia, one of the programs I worked for, you had to have one of the 4 top diagnoses. You had to have either major depression, schizophrenia, bipolar, or schizoaffective. So I worked with a lot of people with schizophrenia, and I never felt threatened except once. I had one client who stole his father's gun after his father died and kept it on him, but he wasn't taking his medications. And I'm over here driving this guy around to the store and doing all this because that's what my job entailed, making sure that he was okay in his home, because we would help find them homes and then help them keep them up so they could become productive members of society. Well, the whole time this guy's carrying a gun on him, and I have no idea. The mother reported it stolen, said that he was the last one there, and we really can't search him. We're not the cops. So I'm driving him around, doing what I got to do and everything. And then I finally said, you know what? I got to get an OPC on this guy, which is not an OPC. Yeah. Order of Protective Custody, where they go into the hospital against their will, what they also call the 72-hour hold. So I got the sheriffs to go out there, and me and my supervisor went out there with him to his apartments. He freaked out so bad, he started shooting at us. He shot at the cops. He shot at me. He shot at my boss. We all just went. And the cops yelled at us, "Go, run, run." And we ran and hid. And then the cops subdued him, and they had to beat him down, really. And so the final picture of him was him in the back seat of a cop car, bleeding from the beating, and on his way to another locked institution up in North Texas. So they blamed that on me, but what could I do? I didn't know he had the gun. I'm the one who was in danger, and I was following protocol, and it just so happened we became his targets because when he saw us, he saw something dangerous, whether it was dangerous or not. Okay. It's a lifelong illness, but it can be productive. They can still be productive members of society with the right treatment, and researchers are developing more effective drugs and understanding of the illness. Now, our history with mental illness sucks. Basically, it was custodial care type treatment for people who were crazy in the head. They didn't have, a lot of times they didn't even know what was wrong with them. That's when they were doing a lot of lobotomies, and they would just lock up anybody who was not normal and put them in an institution. They would wash them and bathe them by just hosing them down from a stairwell up on top, and everybody's at the bottom, and it was really just like throwing away your trash and keeping it from smelling because you're keeping it alive, so they've come a long way. Even with some of the medications that they used to give some very potent medications that they do not really give anymore because of the potential side effects and the fact that they tend to zombify these people. So, some of the causes are, of course, we've talked about it before, genes play a big part in it. Um, it occurs in 10% for people who already have it within their family. So if you already have someone in your family with a mental illness or schizophrenia, it specifically, then you have a 10% chance of getting it. Researchers have found that in part there are rare genetic mutations. Well, of course, there's something going on in their brain. It's making them unable to be a part of reality. I mean, they actually leave reality for a while. And researchers, let's see, other studies suggest that schizophrenia may result in part when a certain gene that is key to making important brain chemicals malfunctions. This research is ongoing. So they think that there is something, they found something in the brain that they feel is not working properly. So they are continuing to research to see if there is some legitimacy to that particular study. Scientists don't yet know all the gene variations that contribute to schizophrenia. Therefore, these genome scans are unlikely to provide full information that they need. So we know genes play a part. We know hereditary plays a part. We know environment plays a part, because when you have it in your family already, you already have a predisposition to getting it. And then when you get older and you start to get older, environmental factors play a part in it and end up making you have your break. The break we always talk about, where that's when you've been diagnosed, and then from that point on you're being treated for the illness. Hopefully you're being treated. Scientists think interactions between genes and environment are necessary for schizophrenia to develop. So I just said, your environment will play a part in it. If you're already predispositioned and your environment is crap, then you're more than likely going to end up with a mental illness, particularly schizophrenia. The different brain chemistry and structure, scientists believe that an imbalance in the complex interrelated chemical reactions of the brain involving the neurotransmitters dopamine and glutamate, and possibly some others, play a role. So dopamine is so important. We talked about dopamine before. Dopamine also has to do with depression and bipolar. When the dopamine and the serotonin in your brain are being messed with, your brain's not going to react the way it should, and you're going to exhibit behaviors and moods that are far from the norm. Okay. Also, in small ways, brains of people with schizophrenia look different than healthy brains. Like, for instance, they have fluid-filled cavities at the center of the brain called ventricles, and those are larger in some people with schizophrenia. So they think that the ventricles, the fluid in the ventricles have something to do with the disease as well. The brains of people with this illness also tend to have less gray matter, and some areas of the brain may have more or less activity. So the gray matter is being affected. You got the gray matters, you got the fluid-filled cavities, the ventricles, and your dopamine and glutamate, and all of that going on. And they're looking into all that because at some point they all felt and believed that those all play a part in the illness. But unfortunately, there is no exact science when it comes to mental illness. They have a very good brand of definitions in the DSM-5, and the people who contribute to it have done a lot of research in it, even if it's a very rare disease that you probably never heard of, which happened to me recently. I heard of one that had to do with a body, something about not liking your body to the point where you're willing to do anything, and this girl made herself blind so she wouldn't have to live with her body and her looks and whatever, and I can't remember what they call it. It's like body dysmorphic function or something, and it's just been put into the DSM. It wasn't in there before, but it started popping up in the last few years, and so this particular doctor started doing research on it, and it's now added in there. So that's just an example. Let's see. The brains of people. Some experts think problems during the brain development before birth may lead to faulty connections. Now, we know our brains have a lot of connections going on. You know, you got synapses going and radio little waves, and I mean, basically your brain is just shooting out information as it's gathering information in and letting information out. So somewhere there is a faulty wire that's contributing to who they are, and they haven't pinpointed which one yet or anything, but the research for this is constant. That's why they always have those clinical trial researches, you know, that I've told you about on other films, that on my other videos at clinicaltrials.gov is from the National Institute for Mental Health. And if you're interested in participating in one of those, all you have to do is go to that website and see if you're a viable candidate. So they're still studying the disease. Like I said, they haven't come up with a full-blown answer. They have some ideas what they think it is, and I've told you what they are, so that's where we are with what causes it. Now, who is at risk? About 1% of Americans have schizophrenia. It affects men and women equally. The symptoms start between the ages of 16 and 30. Men tend to experience before women, so if they're going to get schizophrenia, they tend to get it before a woman would get schizophrenia at the same age. People don't usually get it after age 45, but it can happen. The breaks can happen at any point in your life, and you just don't know, you know, when that's going to happen or anything, but it is a possibility. It is something that could happen. People don't usually, no, it rarely occurs in children, but awareness of child onset schizophrenia is increasing. So where all kids were once ADHD and needed medicines and they were ADD and all that, well, now they're starting to look at children for all mental illnesses: depression, bipolar, schizophrenia, schizoaffective, whatever. They're starting to look at them for all, and those are like the four majors that I mentioned, and they're starting to look at them with all of those in children to see if there is something in their childhood or something in their brain going on during their childhood which leads to it in their adult life. Okay? Now, it's hard to diagnose it in teens because it mimics normal teenage behaviors. In young people who develop the disease, this stage is known as the prodromal period. Prodromal? P-R-O-D-O-M-A-L. How do you pronounce that? Prodromal period. Signs and symptoms fall into three broad categories. You have positive symptoms, which are psychotic behavior not seen in healthy people. They often lose touch with reality and the symptoms come and go. They have hallucinations like we talked about. They see, hear, smell, or feel. They have things that are not there. And they have delusions, false beliefs that are not part of the person's culture and do not change. That's where someone could be considered paranoid schizophrenic. I mean, you could be schizophrenia, but they can add stuff to that. You know, paranoid schizophrenia, undifferentiated schizophrenia, different titles of it, just depending on what symptoms they're exhibiting. And so when they do have the paranoia, that's what we call ideas of persecution, when they think people are out to get them. You know, that's basically that. Thought disorders, unusual or dysfunctional way of thinking, means a person has trouble organizing his or her thoughts or connecting them logically. They're garbled and they're hard to understand, and a lot of times they rhyme. They'll just sit there and rhyme. You know, they'll be like, Joe Schmo Blow went to the stove and left his toe and store more, pour, and and they'll just do that over and over. And usually that's people who are experiencing voices all the time. Now there's some people with schizophrenia who don't experience the voices all the time, and if they could find the right combination of medicines, they can stop the voices, for a while anyway, and let that person have a chance at life. But for the other ones who their voices never stop, that you'll be hearing them doing that kind of stuff, rhyming and talking in their sleep and arguing with their voices. Shut up, I'm not going to listen to you, you don't know what you're talking, and you'll hear them arguing with themselves. And they'll type hyper talk, and like I said, rhyming. They do these weird rhymes that just make no sense. Just core, pour, tor, store, Jack Black bit a cat, and stuff like that, so another form is thought blocking, which is forces guiding thoughts out of their head. They think that somebody is blocking their thinking. That's basically what that says, is they think that they're not free, they don't have free will with their thoughts. Finally, a person with a thought disorder might make up meaningless words, what they call neologisms. And that goes back to what I was talking about, the repeating of the behavior, his, this, Mrs. I mean, they're going to make up words that rhyme but don't really make sense, but it makes sense to them in their head and the voices. The movement disorders may appear as agitated, repeat certain motions over and over. I talked about that. The rocking, they rock back and forth, and they could be playing with their hands at the same time. They begin doing, something like this, or whatever. And, I'm going to tell you that most of the people that I've worked with schizophrenia were pretty much on the genius level of IQ. I had a medical doctor, I had a teacher, I had a chemist, and that's what they say. Some of the most brilliant people are not only the messiest, but they're the craziest. That's what they say. And whoever they are, but they do say that. Another extreme state is catatonic. Now, catatonic, I've had experience directly with someone who was a catatonic schizophrenic. And it's very rare today, but this is when I was doing clinicals in the early 90s, and I was at San Francisco General Hospital, and there was a girl in there who was catatonic. She was going to college, so she was in her early 20s, and she would just lay there. And if somebody put a spoon in her hand, she would leave her arm up with the spoon in there, not putting it to her mouth for a long time. And I remember one time, I was about 19 or something, so I tried to get her up moving so I could say, hey, I got her out of the catatonic state, or whatever. And I went and I pulled her blankets down, and she popped up like a mummy or something and tried to bite my hand, and then laid back down and did nothing. No facial expression. She had a little grin. So I kind of felt like she still knew what was going on. But she did not really eat. They had to feed her, and because they would give her the spoon, and then she would just sit like this with the spoon. And that's it. And then they'd put their hand down and get another spoon of food, and she would just sit there for a long time like this. So I don't know whatever happened to her, but it's extremely interesting, this disease, as I think they all are. Now, negative symptoms versus positive symptoms, okay? Negative symptoms are associated with disruptions to normal emotions and behavior. Some symptoms are flat affect. Now, you can tell by looking at a person's face if they have a flat affect. And basically what that means is it looks like their face is being dragged down. I mean, they're like, no makeup, no fixing up, no nothing. I mean, it's just... And you can see in their eyes, they're tired, they're not thinking clearly. I mean, it's just flat, nothing, just, like that. And They have lack of pleasure in everyday life, as most mental illnesses can do. They begin a sustained plan of activity, speaking little even when forced. A lot of them don't want to talk. I remember trying to do, it was a curriculum-based, community-based training, and a lot of them don't participate in that. And so you just have to do your best with it and give them the time they need to be comfortable with you. Don't just run up on them and say, you're gonna do this, because that will freak them out. But just, work at their level and help them as much as you can. People with the negative symptoms need help with daily activities, and they often neglect their hygiene. So these are usually a lot of these people that you see downtown in your town, because every town has a downtown that looks like this. And you see those people under the bridge and hanging out on certain street corners and, pushing shopping carts and stuff like that. That's the image that a lot of people have of people with schizophrenia, and it's not far off, but it's not completely true either. It can go either way. I mean, I had clients who were schizophrenic and chose to live out like that. We could get them a place to live, but they chose to live on the streets. So, and they would just get their mail at a community center or something, and then they would be back out there. We have to go look for them on the streets if we wanted to visit with them, which is what our intention was: decrease hospitalizations, increase their level of potential, and make them productive members of society. So that's what we were supposed to do in one of my jobs, one of my more latest jobs. Cognitive symptoms are subtle symptoms which include poor executive functioning, which is the ability to understand information and use it to make decisions. Remember, we talked about the administrative functions of the brain, I think, in the bipolar video. So it's being affected here too. It's just bad decision making, basically. I mean, you're making bad decisions, impulsivity usually on the part of a bipolar, and who knows on the part of a schizophrenic. I mean, they could, like I said, this guy with the gun shooting at us, or, they could just hit you out of nowhere, and then they never hit you before, and you've been working with them for 2 years or whatever the case may be. So, I mean, you can never let your guard completely down, no matter how comfortable you are with somebody with mental illness, because you don't know if they're going to stop taking their medications, because many of them do. They start to feel better, so they feel they don't need their medications anymore, or they feel they don't need medications at all, so they don't take them, and then they get sick, and they're used to being in a sick state, and then they may not even recognize you anymore, and you have to remind them of who you are, and it could be quite challenging, but it's very rewarding when you see that these people can live on their own and start to learn to manage their own money, and start to have relationships with people and do social activities and things like that. So they have trouble focusing or paying attention, problems with working memory, ability to use the information immediately after losing it. They have that. It's like short-term memory loss kind of a thing. The cognitive symptoms often make it hard to lead a normal life and earn a living. They can cause great emotional distress, and of course they can. I mean, if you listen to what I just described as what the cognitive thought symptoms were, of course it's going to be difficult to live on your own. I mean, the clients we dealt with, they were living on their own. Maybe a couple of them had roommates at their own choice, but we had to go and check on them a lot, because we had to make sure that they were not hurting themselves, and that they were taking their medications as prescribed and meeting their doctor's appointments, and getting their groceries, and are they eating, and all. I mean, we were like their parents. We were really, really into their lives. So it's a touch and go. It can go either way. I can't sit here and tell you and lie to you or exaggerate the fact of what schizophrenia is. It is what it is. And what it is it's hard to determine what causes it. There's many theories in the field. The symptoms are all the same, but not everybody has all the symptoms. Someone could just have hallucinations. Another one could just have delusions. Some of them could have both. You know, some could be hearing just one voice. Some could be hearing many voices. You know, so, and they need that stimulation from an outsider to help them, you know, get back on the right track. People taking the medications should not drive or make big decisions until they know how the meds affect them. And that's any kind of narcotic or anything like that, because some of them make them drowsy. So if it makes you drowsy, don't be doing, and they don't drive. Most of them don't drive anyway. You know, we were driving them around or teaching them to use the bus. Some symptoms are drowsiness, dizziness with changing positions, blurred vision, rapid heartbeat, sensitivity to the sun, skin rashes, menstrual problems for women, and can cause major weight gain and change metabolism. Now remember, I told you in, I believe it was the bipolar video about Depakote. Yeah, because Depakote is used for mood disorders and for seizures. And I told you about the client that I have, the young guy who was skinny by nature, damn fly, who was skinny by nature, but once he was taking Depakote, he blew up. I mean, he was huge. And then once he got off the Depakote, he went back to his regular weight. So he was skinny again. So you got to be aware of that. And when you go, if you love somebody with schizophrenia or you're helping somebody with schizophrenia, please go with them to their appointments if you can, because most of the time their appointments are going to be them just sitting there saying nothing, and the doctor just kind of writing whatever, keep going what you're doing, and you know, nothing more gets accomplished than what's being done already, when there could be the opportunity for them to get some additional help that might help them live a better life. Okay, so some typical antipsychotic medications can cause side effects related to physical movement, rigidity, persistent muscle spasm, tremors, and restlessness. And I know that a lot of the older medications, the older psychotropics that they used to use, did just that. Sometimes they have to keep trying different medications before they find out what works for them. Remember, we talked about that also before, and that has to do with any mental illness, but schizophrenia is a tougher one because you have to look at all the side effects, and you're mixing medications. You know, you're going to be giving them an antipsychotic, you're probably going to give them a mood stabilizer at the same time. So they're on an antipsychotic, a mood stabilizer, and maybe an antidepressant. You know, you don't know. It just depends what they're experiencing. If they're experiencing the schizophrenic symptoms, but they're also talking suicidal, well, then there's some depressive stuff that doesn't really go with schizophrenia by itself. So you got to keep working with medication, and sometimes they have to be in the hospital, put inpatient, until they can find the right combination of medications for them, because if they let them out before that happens, they will exacerbate, their symptoms will exacerbate, and they could hurt themselves or someone. There'll be imminent harm there. So you don't want that to happen. But for our clients that were community-based treatment, we would take them to the doctors, and we would sit with the doctors and tell them how they were doing, and we would add to it if the person didn't. If the person was talking, if the person wasn't talking at all, we would tell the doctors what the person was doing. So, you know, at least appropriate information was being relayed between professionals. And remember, long-term, we've talked about this in all the other videos, long-term usage of any psychotropic, mood disorder, antidepressant, any of those can lead to tardive dyskinesia. And we talked about that. It's irreversible damage to, and it usually happens around the face, the mouth more specifically, where their tongue keeps going in and out, and they're smacking, and they're shuffling their feet, and they have movements, they do movements and stuff that they just don't even realize they're doing, and they can't stop it. They can't stop it. The damage has been done. Let's see. Antipsychotic medication can produce unpleasant or dangerous effects when mixed with other meds. So that's why it's really important to speak to the doctor about anything you're feeling, no matter if you're afraid, oh God, the doctor's going to change my medicine, I don't want to be changed again, I'm just getting used to this one, or whatever. But you have to tell them, because if they don't know, they can't fix it. Unless they can see it and it's very evident on the way you look, then they'll know how you're functioning. I mean, if you're disheveled and you don't look clean and your hair's messed up and you smell like 10-day urine, they're going to know that you're not where you should be in the treatment process. So they're going to act on that. Hopefully, if you get good psychiatrists, they will, or psychologists. To find out more about how antipsychotics worked, the National Institute for the Mental Health funded a study called CATIE, C-A-T-I-E, and it stands for Clinical Antipsychotic Trials of Intervention Effectiveness. That's a lot of big words, but basically they're just doing those trials I was telling you about. And the psychosocial treatments, we've talked about psychosocial stressors in some of my other videos, and that, excuse me, that has to do with your environment, your psychosocial. Do you have a support system? Are you working? Do you have money at all from Social Security or working or whatever? Do you have a place to live? These are all psychosocial factors that we look at when working with the client to determine the best treatment plan for them. And some of the people who do those is like what I was doing. I did nursing, I did casework, I did management, and I did teaching. Yeah, psychologically based, curriculum based teaching to people in the community setting in their natural home environments, and that was called. Sorry, forgot, I got bit. It used to be a program that was out. I don't know if it's still out, but I can't remember the name. I'm totally blanking. I'm sorry. If I remember, I'll get back to you. But the treatment team usually consists of a doctor, an RN, a caseworker, or caseworkers, depending on acting. That's what I was trying to think of. ACT. Assertive Community Treatment. I worked on one of those teams, and then when I went up to the supervisory level, I had a county out in about 2 hours from us where they had that program as well. So I was very well versed in that program and what its intentions were, and we spoke at conferences on that program and what it has to offer people with severe and persistent mental illness where other modalities of treatment have failed. So the ACT program, the ACT program, it's still in existence as far as I know, and they even have it to where they specify if it's forensic involved. So like we were working with clients who were NGRI, not guilty by reason of insanity, and now they have a special group that is just dealing with people like that. They're not mixed in with the regular schizophrenic population that we work with. So, but it's a whole treatment team. It takes a whole treatment team to do that, and just depending on where you're getting your treatment from is going to depend on how good it is, how often you're seen, and all that. Rehab emphasizes social and vocational training to help people with schizophrenia function better in their communities. I talk about ACT, like I told you. The purpose of ACT is ACT, Assertive Community Treatment, is to provide curriculum-based training, support, and assistance to people in their normal settings. So their home, their jobs, whoever they're living with, they live by themselves, they live with someone, their families. You provide for their families as well. You give them a break, actually, a lot of times when you take the client out with you to do things. And And it's a really intensive program. I mean, you see these people at no less than 3 times per week if you can find them. And sometimes you see them every day, depending on how sick they are. And then the program has an on-call. So there's 24/7 program. So it's always going. There's always somebody available to respond to a crisis situation. And what we have here in our county is a sheriff's department program that has caseworkers or clinicians working with the sheriff's department on such calls. So say we get a call, this person's acting out, the parents are scared that their child is going to hurt them or whatever, and the person's freaking out. They'll call us, we'll, triage the situation and determine whether to call that, because that group of people with the sheriffs, they have the ability to put somebody in the hospital like that, whereas we have to do paperwork and go to a judge and get it signed in order to put them in the hospital against their will. But the sheriffs can do it right then and there if they deem it necessary. So they are the crisis group, and they, like I said, they consist of clinicians and sheriff's department. And let's see, there's also family education sessions. I told you all about NAMI, the National Alliance for the Mentally Ill, which I'm extremely involved with. I could be more involved, but I'm a professional member, have been for years and years. I've gone to their meetings. I've spoken at their meetings with my panel of clients, and that's why they gave me that award, because I was doing that all over San Antonio. And but they offer family education and support, and NAMI is a grassroots organization, so they're very approachable and reachable, and you can participate in the lobbying that they do at the state capitol for more mental health funds to meet the needs. The demand is more than what we have to offer. I mean, Texas is always been one of the last of the 50 states in mental health. One time they were 50 out of the 50. Then another time they were 49, and then they were 48. I've never seen them get under 45. I don't know if it's happened. I could have overlooked that one particular time or two or whatever, but all the time I was doing it, Texas was always one of the ones that was last in providing the funds, more funds. So NAMI goes and lobbies the state capitol and has lobbyists to help get funds for people with severe and persistent mental illness. So you can be a family member and you can get treatment just as much. I mean, I'm not saying they're going to give you medication unless you're sick too, but what I'm saying is you can be in a group with people who know what it's like to be you, who knows what it's like to deal with a person with schizophrenia and the erraticness of it, because you never know what to expect. You never know if they're going to, freak out on you or freak out in general and run in the middle of the road. Had someone do that one time. Run in the middle of the road and try to get hit. That's happened. I had a teenage client run away. She wasn't in my dorm, but she was from the teenage dorm, and she was trying to run across a freeway, what we call the death loop, and she made it across the first two, which was the oncoming traffic in our direction. But when she got to the other side where the cars were going in the other direction, one car missed her, but the other car didn't see her and killed her on the spot. So, and she was being chased when this happened because she wasn't supposed to be out of the facility. She was a teenager that was from another state, I believe. We used to take a lot of people from out of state, especially like Philadelphia and stuff like that, and they would get, specific care at this acute facility I worked at, and a lot of them would try to run away, and some of them would make it. And there's really not much around there. Well, there's houses and stuff, but at the directions they're running, there isn't really much but forests and stuff like that. And of course, they put themselves in more danger than if they would just stay put. And that girl lost her life, and she was only about 15 or 16. There was no need for that. So, Let's see, cognitive behavioral therapy, the CBT, we talked about that. Remember, that was where they combine the cognitive and behavioral modalities of treatment together, and so they use that because it has to do with thinking and behavior when you're dealing with someone with schizophrenia. They have thinking problem with their cognition, but their behaviors are also erratic. You might see them dancing at the corner at a street light in 3 jackets, 5 pairs of pants, 3 pairs of socks, some radio shoes or no shoes at all, and it's 105 degrees outside. Something like that. Those are the kind of things you need to look for. You need to look for things out of the norm. So a person who's dressed up like it's winter and it's 105 degrees outside and they don't want to remove any of their clothing, they are not doing good right now. So keep that in mind. They can be violent, but they're usually not. They're usually not violent. They're usually the victims that we have to stick up for. And who we had to stick up for them a lot with, sadly, was the care homes that rent out rooms and stuff and are licensed by the state to provide housing to people with mental illness. And they usually take up all their whole check, their whole Social Security check, to live there, and they get maybe about $30 for the month to spend, and most of them smoke. So I always carried cigarettes in my car if they didn't have any cigarettes, so that I could give them 1 or 2 while I was meeting with them, so they could be at ease and stuff. And I wasn't the only one who did that. A lot of people did that. It's just because they're living in places that's taking most of their money, so they don't have any money. People with this illness attempt suicide more often than the others. About 10%, especially young males, die by suicide. So when they're tripping out, they could kill themselves. They could have those suicidal ideations, and the voice is telling them, kill yourself, you're no good, you're worthless, you're useless, nobody loves you, we hate you, and you're hearing this, and it won't go away, and nothing you do will make it stop, and it's just too much. Yeah, someone will kill themselves. So that's something you have to be on the lookout for also. Okay? Sometimes illegal drugs make it difficult and can exacerbate the symptoms. We all know that. Drinking and driving, messy medications, especially when they're controlled medications, mixing with alcohol, since alcohol is a depressant, then it could make them more depressed and more prone to suicide. So keep that in mind. People with schizophrenia smoke more than the general public. Like I said, they smoke. Most of them smoke. And it's the most common form of substance abuse for people with schizophrenia. They'd rather have a cigarette than a beer, usually. It just really depends on the person, but I can tell you, out of 100 clients that I worked with, 99 smoked. So that's why I always had cigarettes. Because I could give them cigarettes while I was meeting with them, giving them quality time and quality care, hopefully, and they could be relaxed, not fiending after a cigarette, so, let's see, that's the most common. Okay, researchers are still researching if there is something to the smoking addiction. They want to know, because even addicts of drugs and alcohol, which alcohol really is a drug, but it's legal, so they always separate it. But if they're addicted to drugs, they're going to be addicted to cigarettes more than likely, and they're going to smoke to help calm the times they are not high, or to help enhance the times that they are high. So there could be something to it. Maybe there is. I mean, our brains are shaped, we have these little things are shaped like little squares. I don't know if you can see if I'm doing it too fast, but just like up, down, like upside down, almost rectangular. And neurons and stuff and information is supposed to go into those holes to fill them. Well, they have found out that addictions and illnesses, there's a problem there because they're not being filled, right? So what are they filling them with? Drugs, alcohol, cigarettes. So there's something in there in the brain And I learned that in a neuropsychology class, that of graduate level, that's why a lot of people have the addictive personality or whatever, because there's a predisposed in their brain because of that part of the brain that is not being fed the nutrients and the like we said, there's a rip, there's a tear in the transmission process. So that's pretty much it with schizophrenia. If you have any other questions or you want some direct information from me about experience, or if you think someone has schizophrenia and you're not sure or anything like that, it's a pretty simple disease in the sense that you can pretty much tell when someone's schizophrenic versus bipolar versus depression. Hit me up on my email. Remember, my email is dear_Tina88@yahoo.com, and I will be glad to answer any more questions that you have about it. But as usual, like I do in all my videos, I'm going to recommend 2 movies. Now, A Beautiful Mind was based on a true story. Unfortunately, the person that the story is based after, him and his wife, just passed away like a month or so ago in a car accident. But Russell Crowe plays an extraordinary role in this movie that was directed by Richie Cunningham, what's his name? Ron Howard. And then the other one is Call Me Crazy, a 5 film. Now, I know I keep bringing that movie up, but the reason I keep bringing that movie up is because it talks about different illnesses. The first story has to do with schizophrenia, and her character is really integrated into some of the other parts of the other stories that are told about the other illnesses. So you don't just see her with her schizophrenic self or whatever. You see her with that, but then you see her with family dynamics, and then you see her trying to help others. And I mean, it's 5 little stories, and they each stop somewhere, and they're all directed by different famous people. I think Bryce Dallas Howard is the one who did Schizophrenia. I believe Laura Dern is the one who did Bipolar. Sharon Maguire did the third story. PTSD. Ashley Judd. I can't remember. But anyway, it's a great movie. I own it, like I said before. I watch it. I recommend it to people. If you want to understand mental illness better, that's a good movie to watch. It was approved by NAMI, the National Alliance for Mentally Ill, and NAMI will speak against any movies that seem far-fetched from the truth, because they're trying to get the truth out there. They are trying to make sure that people are being treated fairly, and that they're being treated, period, for their illnesses. So that's why they do all that lobbying and stuff. But they offer groups, and speakers come, like doctors and, specialists in different fields come and speak, at their general meetings. Tend to have general meetings once a month and stuff. And there's a NAMI probably right where you live if you want to be a part of that organization in any way. You can volunteer, you can pay to be a member, and they have different prices for different member levels. So, but it's very reasonable and worth it. Well, that's all I got. Remember, A Beautiful Mind is a fantastic movie, and Call Me Crazy, a 5 film. Thanks for watching. Don't forget to subscribe, and please share, and let others know what I'm doing here, because you never know who I might help. I never know who I might help when I do these videos. I do them because I like to share what I've learned and gone through, which has been over 2 decades of a lot in 2 different states and many different cities. So I hope that you would take the time to share it also, and subscribe. And if you want to email me, I told you what the email is, but I'll say it again, dear_Tina88@yahoo.com. I look forward to hearing from you, and look forward to doing the next video for you. Thank you for paying attention and being interested in my videos. I appreciate y'all's support. Love ya. Bye.